is Amanda Fialk. I am the Chief Clinical Officer at the Dorm in New York City and Washington, D.C. Thank you so much for being here today. Before we get officially started and I introduce Dr. Myers, I just want to do some light housekeeping. This will be a roughly 35-ish minute presentation. You will receive the slides, you will receive a recording after the presentation along with all of our contact information. If you have any questions, want to keep the conversation going, please don't hesitate to reach out. This is being recorded, so everybody knows, so that we can then upload it to our YouTube channel. So if you don't want your image to appear in the recording, you're welcome to turn off your camera, although we do love seeing everybody's faces. So we encourage that as well. We will have an interactive discussion after the presentation is over. So if you have any questions and comments, feel free to write them in the chat, and I promise we will do our best to get to all of them at the end. Today's presentation is about social anxiety and substance use disorders in adolescents and young adults. With us today is Dr. Jarell Myers from the Center for Motivation and Change. He's a psychologist specializing in CBT and DBT. He earned his doctorate in clinical psychology from Farley Dickinson University and completed an APA-accredited internship at Mount Sinai St. Luke's Hospital. Dr. Myers completed a fellowship in child and adolescent psychology at New York Presbyterian Hospital, Weill Cornell Medical Center, focusing on the treatment for anxiety. He used that experience at McLean Hospital, where he worked with children and adolescents diagnosed with anxiety and OCD in an intensive outpatient clinic. He has expertise in working with adolescents and young adults with comorbid anxiety and substance use disorder and adopts a harm reduction approach. So without further ado, I will now turn our presentation over to Dr. Myers. Thank you.
Thank you so much, Amanda. Really excited to be here and to be sitting with you all and sharing this information. So thank you for being here, and thank you for listening to me. I can go on and on. I can talk for a whole lot. I'm going to do my best to keep it tight so that we have time to do question and answers at the end and all of that. But as you can see, we're going to be talking about social anxiety and substance use disorder in adolescents and young adults. This information honestly can be applied to anyone who may be experiencing anxiety and substance use. What we're going to be covering today is thinking about fear and anxiety, thinking about how we cope with all of that. Thinking about where substance use comes into play in all this and why someone would be using a substance if they're feeling anxious, how it can be helpful, especially in the short term. And then thinking about what treatment looks like. What are we going to do with someone who is anxious, who is using a substance, who doesn't want to be anxious anymore, but is having a hard time breaking up with anxiety and breaking up with the substance. And then I'm going to provide a quick case example, someone who I have worked with in the past, who has experienced both, and how I went about doing treatment with them. So I'm going to try to pull in all the different pieces that we discussed today. If you have any questions, any thoughts, anything like that, you can put them in the chat. So let's start out with the foundational basic pieces, right? What we're talking about here today at its core is fear. Now, a lot of people don't like fear because it feels very uncomfortable. However, it's a core human emotion. It has done a very good job of keeping us alive as a species. I like to say to my patients that your ancestors were the ones who didn't jump off the cliff to see what was at the bottom. They didn't stick their heads in the hungry lion's mouth, right? They were the ones who were much more cautious and careful. So there's this genetic predisposition to experience fear, and there's absolutely nothing wrong with that. The problem is that as we evolved as humans, our brains evolved, we became more thoughtful, we organized more, we planned more, that there's all this stuff going on in the frontal lobe. The stuff at the back there, the stuff that was originally there with us, didn't necessarily evolve with us. So the experiences that we have, the triggers, the stimuli that we may have that may trigger our fear for us, those have evolved over time. But the actual hardware that's there in our brain, that hasn't really changed a whole lot. And if we were to think about the specific part of the brain that houses our emotions and specifically around fear, it's the amygdala. It's kind of like an on and off switch that has a dimmer, right? Um, if there's something that triggers it, it's going to go on. Now, the thing that triggers it may only trigger it a little bit, so the dimmer might be a little bit lower, versus something that triggers it that makes it a lot higher, the dimmer is a lot higher, right? So it's a lot brighter, there's a lot more alarm bells going off. But ultimately, it's just an on and off switch. So am I feeling fear? Am I not feeling fear? That's kind of it. If we could go to the next slide. As we are now evolving as humans, we started to develop these mood states, and anxiety being one of those mood states. So this is fear occurring over time, right? Linked to something that has triggered that fear for us, right? So we have now changed our relationship with fear. Initially, and what we've come to know and love when it comes to this specific emotion is that our reaction to it is rewarding for us in some way, shape, or form, or carries a consequence, or may carry a consequence. So if I am standing in the middle of a desert somewhere, right, and I hear rattling in the air, my fear starts to peak up a little bit because I'm concerned that that rattling could mean a rattlesnake. And I know that rattlesnakes are poisonous. So if I get bitten by a rattlesnake in the middle of a desert, that might be it for me. I might not make it, right? So I am immediately put in this frame of mind. My body is put in this frame to react to that by running away, by fighting back, by freezing up, right? But by doing something to protect myself as best as possible. When I get away from that situation that's dangerous, so if I get away from the rattlesnake, I don't hear the rattling anymore. There's this immediate sense of relief that comes over me. I get the reward of doing what that emotion has asked me to do. By following through on it, I get relief. The unseen part of that, the underlying part of that is if I've learned now that, or if I've seen, excuse me, that if I get away from this rattlesnake, one, I'm no longer in danger, but two, my body kind of feels better because I'm not as uptight. Everything isn't as tense. My heart isn't racing. My breathing isn't as shallow. If those things are occurring and I get out of the situation and I feel much better, I'm learning over time that it's better for me not to be in that situation and not to feel those things. So as we've sort of, as our brains have developed, as situations around us have developed, as society has developed, our relationship with fear and from that, the growth of anxiety has changed as well, right? Again, that on and off switch in the back of our heads right here, right? The amygdala, is just responding in an on and off way. Frontal cortex, this here, the last part that really developed in our brains, that deals with reasoning, that deals with planning, that deals with organization, right? It's coming from a much more logical place. We can't talk to the amygdala to get it to shut on and off. If I'm fearful of something, I'm gonna feel fearful of it. I can't talk myself out of it logically. Doesn't make any sense for me to do that, right? So ultimately, what we're learning from our relationship with fear as it develops into anxiety, this elongated fear state, is that it feels bad. I don't want to be in that situation. And if I get out of it, it feels much better for me. That's anxiety in general. That's sort of how we think about anxiety in general. When we're speaking specifically about social anxiety, what we're talking about is how a person is thinking and interacting with their surroundings. That there are perhaps certain assumptions that we are making, we as people who are socially anxious, that we are making about being in an environment around other people. If I'm making that assumption, it makes it more difficult for me to be in that situation. If the thought that I'm having about being in that situation activates fear for me, go back to the learning that we just talked about. If I get out of that situation, it immediately feels better. I get a relief from it. And I learn over time, it's better for me not to be in that situation. The problem is, human race, we're social animals. We're meant to be in community. We long for and seek out relationships with others. So when someone is experiencing social anxiety or anxiety in general, they're having thoughts, they're experiencing something physically that pulls them away from what the norm is, whether that's connection with people, being outside, whatever the case may be. It pulls us away from our norm and kind of closes off the world for us. And the learning, again, that takes place over time is the more and more that I get away from those things, the better that I feel initially in the short term. That doesn't mean that long term I get over it, but it just means that in the short term, I'm able to deal with it. So let's jump to the next slide. How do we cope with that? What are the things that we do to cope with fear? Well, we don't put ourselves in that situation as much as possible. We do our best to avoid it. And avoidance works. It works really, really well. If I am afraid of snakes and I don't put myself in a position where snakes might be, then I'm not afraid, then I don't have to deal with the fear of snakes. And that feels really good. Feels great, as a matter of fact. The problem is when we're dealing with those situations where they are the norm and we're pulling back from them, that avoidance means that we don't get to engage with those situations that we typically would engage. So if I'm socially anxious and I'm worried about other kids at school who may be thinking that I'm weird, or I may do something embarrassing and everybody laughs at me for the rest of the school year or for the rest of the time that I'm in that school, of course I'm going to want to avoid that situation. That feels uncomfortable and it feels better for me to be out of it. So I'd much rather avoid it. The only problem is that our avoidance comes with consequences. So for this same kid who may be avoiding school or maybe avoiding being around peers, excuse me, he's also missing out on schoolwork. She may also be missing out on learning something that's of interest. They may be missing out on extracurricular activities. That is also painful for the individual, for the teen, for the young adult, because those things are important to them too. So even if I am avoiding the stimuli that makes me feel uncomfortable, that activates my fear and anxiety, even though I'm avoiding those things, there still is pain and misery that's accompanied with it because I am missing out on certain situations that I'd like to engage in. So if avoidance in and of itself doesn't work, what are other ways that I can learn to cope with the way that I'm feeling? What are other ways that I can kind of shove away or push away the pain? If I'm just avoiding, then I'm still experiencing pain. But is there something that can give me short-term relief? Yeah, absolutely. Substances work really, really well. There is probably nothing that we can offer, that I can offer in my office, that maybe even a psychiatrist can offer in their office, that works as effectively in the short term as a substance at providing some sort of relief. Nothing. It's super duper effective. And the reinforcer that's associated with that relief that that person is feeling, because again, going back to the relief that you feel from getting away from the dangerous situation, it's very similar. It feels as if it gets rid of that pain. It relaxes me, it mellows me out. It allows me to be in situations where I typically wouldn't be in. Even if I'm not as effective as I could be, it feels better for me to use a substance and be in that situation, be altered and be in that situation, as opposed to have to deal with the emotion. That feels really bad. I think that sometimes we can look at people who are using substances and only see what's on the surface, right? That you're using a substance, you're smoking, you're drinking, and you see how bad it is for you, and you continue to keep on doing it. But we don't oftentimes pay attention to what's going on underneath that. So really quickly, before I even get any deeper into that, let's talk about substance use in general. So these next couple of slides that you're going to see are kind of the DSM-5 version of what substance use is and the criteria that we need to make. I put them in here so that you could take a look at them and see them, but let's break it down. Let's make it even simpler than it is. So let's move on to the next slide. So ultimately, when we're thinking about someone who's having an issue with using substances, we're thinking about someone who has had their substance use behaviors and the effects of their substance use get in the way of their normal everyday function, of the things that they're supposed to be doing on a regular basis. If we're thinking about adolescents and maybe even some young adults, they don't have that many jobs. And I'm not talking jobs in terms of occupation. I'm more so talking about jobs in terms of what they're supposed to be doing in life. For the typical adolescent, typical young adult, they got to have some sort of purpose, right? So whether that's they're going to school, whether they got a job, they're doing some sort of extracurricular activity, they're doing something, right? Doing something and interacting with others. Pretty much it. That's all we're really expecting out of adolescents and young adults, that you can get along with people and that you're actually doing something. If we're breaking it down to those basics, you would think it's hard for something, anything, to get in the way of you doing something and you interacting with people. However, substances, as relieving as they are, as calming as they can be, as effective as they can be in the short term, they do a really good job of getting in the way of our everyday function, or they can do that. There are some people who are able to use substances really effectively. So you can drink on the weekends a couple times, a couple drinks, you're good to go. Smoking marijuana or using marijuana in general has become more prevalent nowadays because of the changes in laws and the way that people are seeing them. And so you have some people who may be able to use those things effectively, but it doesn't get in the way of their function. But if we're thinking about, in general, people who are struggling with substances, it's because it's getting in the way of work, it's getting in the way of homework, it's getting in the way of school, it's getting in the way of their relationships with others. It's stopping them from being effective in general. I wonder if we're seeing a pattern here. So social anxiety, or anxiety in general, closes off our world because it's making things seem more and more dangerous. And so it's easier to just kind of stay closed off, stay away from things that could trigger my anxiety. Substance use relieves the pain, but ultimately it makes us less effective in other areas of our lives. And so in some ways, it kind of closes things off as well. So even though I'm getting relief from my anxiety by using a substance, I still may be experiencing the closing off of my world because I'm using a substance in a really ineffective way, in a way that's more so used to cope with an emotion that my body can naturally deal with. It's not comfortable, but I can naturally deal with it. But I'm using it to cope with that and cope with those thoughts, even if the consequences of my substance use or the consequences of my avoidance still remain. So this is the first page of the substance use criteria within DSM-5, the second page of that. So you all can take a look at that on your own. But now I want to talk about what are we going to do to deal with that. So let me take you on a journey really quick. When I started doing anxiety treatment way back when, back in my day, we were told that pretty much you deal with anxiety and that's it. You're only dealing with the anxiety. You may expect that, like, after you deal with some of the anxiety and people start to feel relief and all of that stuff, that you may notice some depression or something else popping up. And you get to deal with that once the anxiety is done, but you deal with the anxiety. So if someone was coming in to see me and they were experiencing anxiety and they were using substances to deal with that anxiety, they had to be treated as two separate and different things. There was a program that I was in prior to being at CMC, and honestly, part of the reason I decided to come to the Center for Motivation and Change is because it felt really difficult to be in that program because of this. But we would ask people to go and deal with your substance use issues first, and then remain sober for 6 weeks. And then after that, you can come back and see me and we can deal with anxiety. Here's the issue with that. If I'm using a substance to deal with my anxiety and you take that substance away from me, you've created this void, right? That's one. But two, you didn't get rid of my anxiety. And when I'm in a substance use treatment center, you're not necessarily teaching me how to deal with my anxiety. So at the end of the day, I'm asking you to now not cope with your anxiety, to just sit with it for 6 weeks after you're out of your treatment center, and then you can come back and see me for anxiety treatment. To me, that feels a little harsh. But at the same time, the reason why that was the protocol is because when you're treating anxiety, and we'll go into how we treat anxiety in a moment, but when you're treating anxiety, you want to create new learning. So remember earlier, I spoke about the fact that the learning that happens is if I am scared of something and I get away from that, or I fight back and I get the relief, the learning that I have is follow what my body wants me to do when I'm in a dangerous situation, and I'll feel good. I'll feel a lot better than I am feeling when I'm anxious or when I'm fearful. So the learning that happens is stay away from that thing, it feels better. Stay away from that thing, it feels better. I want to create new learning because I can't necessarily get rid of that old learning. But what I want to do is create new learning for that individual. I want them to learn that even if you're in that situation, that you can deal with it. Now, I'm not talking about dangerous situations. I'm not going to put somebody, right in the midst of a snake pit with a bunch of rattlesnakes there and cobras. And I'm not doing that. I'm not going to put your life in danger. But for social anxiety, where there's a worry about embarrassment or a worry about judgment from others, I'm going to put you in a situation where others can judge you. And I want you to learn that you can tolerate it, you can deal with it. That as bad as you may think that it is going to be, or anxiety is making it feel as if it's going to be, as bad as that is, you're going to learn to tolerate it. So if I want to create that new learning, I need to have a platform in which there's nothing influencing that at all, because anxiety is sticky in that way. I've seen on more than one occasion where someone will be coming in to see me and will be working on the thing that has made them feel anxious. And they'll say to me, you know what, this was great. And the reason why I was able to do it is because you were here, because I was in your office. But I can't do that out on the street by myself. I can't go home and do that. So anxiety has made it seem as if it's only safe to do those things in my office, as opposed to having them do it on their own outside when they're more than capable of doing that. Very similarly, if someone is under the influence of a substance or is using substances regularly, Will they truly be able to learn that the things that we're doing to combat their anxiety are actually within their capability and power, that they're learning to tolerate it on their own? Or is the learning that I drank or I smoked and it calmed down a lot of the anxiety that I have? And so as a result of that, I can go in and do this thing that you're making me do, that feels really uncomfortable. And so the only way for me to get over this situation is if I use, or if I have something there that helps to keep me calm. We don't want that. So there's always been this battle between like, how do we deal with substance use and how do we deal with anxiety? And if we want true learning to occur, we can't have the person using, of course. But then I can't ask someone to go away for, a couple months, 6 weeks, however long it is, and deal with substance use and not deal with their anxiety. So how do we make that all work? Keep that question in mind. Really quickly, going off on a tangent really quick. How we deal with anxiety, social anxiety, OCD, is through that second point there, exposures, exposures, exposures. That is the gold seal standard treatment for what we do with anxiety. What is an exposure? It is an opportunity for someone to, at its base level, face their fears. If you are afraid of dogs, I want to get you around dogs. I want you to face your fears around dogs. If you're worried about being in public and doing public speaking, I want to get you in situations where you're going to be public speaking. If you are concerned about having a panic attack when you're in the car, I want to get you in the car as much as possible. I'd love it if you had a panic attack in the car so you can learn over time that as uncomfortable as this all is, I can tolerate it, I can deal with it. It's still uncomfortable, but I can deal with it. That's what we do. Now, we need a whole other talk to go into the details of exposures and how we go about doing them and how we sort of plan it out. It's not as basic as that, but it is as basic as that. Face your fears. That's all I want you to do. Face it. So can we find some sort of compromise? Going back to the original question, I want you to do exposures. I want this new learning to occur. I want you to be in a situation where you can see for yourself that as uncomfortable as this is, you can tolerate it. While at the same time, as much as I may want you to stop using, you may not necessarily stop using immediately. So this is what we did. If you can't stop using immediately, is there space for us to still do exposures? Will that affect the learning that could occur? Is there space for us to engage in exposures, perhaps when substance use isn't at the forefront? So let's get into the case example, because this is exactly what we did here with our case. So you'll see the name at the top is John Doe. That is not the person's real name. That name is a name that I created to represent this individual. So there's a 16-year-old cisgender male who lived in Williamsburg, Brooklyn at the time, was a heavy marijuana user, would use a personal vaping device 2 or 3 times a day and would roll joints as well. So this individual was smoking pretty heavily. And the primary reason for him smoking was his own social anxiety. He became school avoidant because he was concerned that everybody in his class was judging him, and he shared a lot of classes with a lot of the same people. He was concerned also that he might trip and fall in the hallway and that the whole school would see, and that would then lead to ridicule for the rest of his time in high school. So it led to him taking away more and more time from school. It led to him interacting less and less with people. But he was seeing the consequence as being losing out on actually building relationships, which is something that he wanted to do. He was living at home with his biological parents, his mom and dad. He had one older sibling who was away at college, who he used to interact with pretty well. In a way, was his safety valve, right? If he was going to hang out with peers, he'd want to make sure that his older sibling was there. So we've got a kid who's socially anxious, who's avoiding school, who's staying away from and avoiding all the situations that might bring about the anxiety in general and the discomfort that he's feeling, bring about the emotion. And in order to cope, he was self-medicating by using marijuana. So he's staying at home, using marijuana, not going to school, or going to school high, in order to cope with what he's experiencing. Okay. When he came to me, he had the parents were extremely concerned because they were worried about all the time that he was missing at school, and they wanted to make sure that he was able to have a friend group because all the other kids had friend groups around him. His motivation was honestly just to be able to go to school and do his work. That was it. When I'm doing treatment with someone like this, I want to make sure that there are certain pieces that we put in place to enable him or anyone else that I'm working with to really delve into what the exposures are. So if we could jump to the next slide. The foundational pieces kind of mimic and mirror what we do in the unified protocol. So I want to build mindful awareness. The reason for that is the more insight that you have into your experience, the more that you can share about it, is the more that you're actually leaning into all of the emotion and the thoughts that are related with the emotion. So I want you to be mindfully aware of what your body is experiencing, all the thoughts that you may be having. I want you to develop actual adaptive coping skills. So we talked about maladaptive ones, right? Avoidance, talked about substance use as an example of relief. But I actually want you to be able to, outside of exposures, if you want to go hang out with some friends and you're going to be there for 3 hours, it may be hard to ask you to do an exposure for 3 hours. But if we did an exposure for the first 15 minutes that you were there and then use coping skills like breathing, like distraction, like self-soothing, if we're able to use things like that to help you stay in the moment with your friends, I'm totally okay with that. And then cognitive coping as well, because we're also dealing with the thoughts that are related with anxiety, right? There are a ton of thoughts there that kind of swirl around in our heads and make things feel really uncomfortable for us. So being able to deal with those thoughts effectively. All that is well and good. That is typical in the work that I do in setting foundation for doing exposures with someone. But for someone who is using a substance, I introduce setting boundaries. So remember, what we're talking about here is having the learning occur. The exposure itself is great, it's wonderful, but really and truly, the fruit that we're picking off of that tree is the learning that occurs. So if you are afraid of dogs, you pet a dog, the dog doesn't bite you, the learning that you have in that moment is maybe not all dogs are dangerous, and I can be around that dog. If you're socially anxious and you can go to school and be at school all day, even if you do something embarrassing, even if it feels uncomfortable the whole time, the learning that takes place is I can be in this environment. It feels uncomfortable, but I can be here. I can do it. It's tolerable. And the more and more that I do it, is the better it becomes for me. The more I'm able to tolerate it. So I want the learning to occur, but I don't want anything to influence it. Can I then set boundaries around the exposures? Can I establish a boundary before the exposure and after the exposure where the person has the opportunity to just experience the emotion? What I mean by that is when you do an exposure, your body is reacting to it as if you were in a dangerous situation. The anxiety is activated. Can you learn to sit with that feeling for a period of time without using a substance? Can you learn to be in the moment with that emotion? Can you lean into the thoughts that you're having? And then, well before outside of the boundary, well after outside of the boundary, after we've established this learning piece, this learning period, excuse me, can you use substances and still have all that learning sit with you? So we wanted to try it out. I wanted to try it out with John to see how this would work for him. Basically, what we did is we said 12 hours before you come in and see me, there's absolutely no smoking. You can't smoke. I want you as sober as possible when you're coming in to see me. 3 hours after our session is done, no smoking. I want you to sit with the emotion. The reason for having the period of time before the exposure where they're not smoking, where they're not using, is because we can anticipate that there's going to be anticipation about coming in and seeing. If you know that you're going to be coming in and doing something that makes you face your fears, then there you go. You're going to have some what we call anticipatory anxiety around that, right? And then after that, I want you to be able to sit with whatever has happened in session. So yes, we've done an exposure. You've felt whatever you felt. It's uncomfortable. Can you then, for the next 3 hours, just be with yourself with that emotion? And even if you decide to smoke 3 hours and 1 second after that, I think we've given enough time for that learning to start to settle in. Is it ideal? No. I would love it if you weren't using a substance. I would love it if you would have the opportunity to just sit with the emotion, and the next time we see each other, you haven't used, you just sat with the emotion. You just experienced the anxiety. You just experienced the fear. However, for someone who may be actively using, who's using substances as a primary coping skill, I cannot necessarily think that they're going to immediately just kind of get rid of the substance. So this is our compromise. This is our way of dealing with it. When we're doing the exposure, we're developing a hierarchy with the person. Hierarchy is basically a list of situations that trigger the fear for him. So for this specific individual, it was sitting in class, and we broke it down to sitting in class for 5 minutes, 10 minutes, 20 minutes for the entire class period. Being at school for a half day, the whole day, for an hour, for a couple of hours. We engage in behavioral experiments. So what that is there is an idea of what could happen. So if I do go to school today because I'm feeling really anxious, I'm going to do something embarrassing. Fantastic. Let's try it out and see what happens. And then actually doing exposures. So you're worried that if you sit in class today, because you've been out of class, everybody's going to come around you and ask a whole bunch of questions and all of that. And that's going to be embarrassing because all the attention is on you. Fantastic. Let's go to class. Let's sit in class for 10 minutes. Let's see what happens, right? We're only going to be there for 10 minutes, and then we'll pull you out and we'll talk about it. We'll debrief about it. And that's that last part there. That's the last part of exposures. Debriefing about it, really talking through what has happened, really allowing that learning to set in. We also had a discussion about when he was going to use coping skills, right? So earlier I used the example of someone going out to hang out with friends for 3 hours. I don't want you to do an exposure for 3 hours because that's really uncomfortable. You could, but I wouldn't want you to, especially when we're just starting out. So what coping skills can we use in that situation? When does the exposure end? What are the things that we want to reinforce for this individual? How are we going to go about reinforcing it for this individual? Okay. So the things that I want you to take away from this: if someone's coming into you and they're expressing, I am anxious, I'm using a substance as a coping skill, you do not have to separate the treatment. You can create boundaries around the treatment in and of itself so that the learning can still take place. What you're going to see over time, or at least what I've seen over time, is even if they continue using, because the social anxiety is being tolerated a lot more, the use starts to come down a bit because it doesn't hold the same value as it did. It's not doing the same things that it did for you in the past. Does that mean it completely disappears? No, not necessarily. There may be other reasons why use may be there, and we can address that specific thing. But just because someone is coming in with anxiety and a substance use disorder doesn't mean that we're forced to treat those two things separately. We can create real world boundaries around it and treat it in real time. I think that was my last slide. Is that correct? Awesome. Great. So I'm open and happy to answer any questions that you may have. Thank you for sitting through that with me. Again, I talk a lot, but I hope that that was clear and all of that wonderful stuff. So thank you.
Thank you so much for that. There was so much important and useful information there. I loved how you really reminded everybody that, a lot of times society or people can look at those who are addicted to substances and scratch their heads and say, like, stop using? Why are you using?
Mhm.
And not realizing that, like, these substances, like, they're using because they're working, like they're
Mhm.
playing a very important function in the role of that individual and protecting them from an even deeper pain.
Mhm.
And that, it's complicated,
Yeah.
and that I think we've come a really long way as a field, generally speaking, in understanding that, people are complex, and when they present to treatment, there's typically not one presenting issue, there's multiple presenting issues. And we used to have people running around to go to one place for their anxiety, another place for
Right.
their depression, a third place for their trauma, a fourth place for their substance use. And it was nonsensical. It's all interrelated. And that
Mhm.
until we deal with it in a comprehensive, coherent manner, people are going to continue to struggle and suffer. So we need to be able to meet the whole person where they're at and address all of their needs simultaneously. So thank you for
Absolutely.
bringing that to life also in the case example. We definitely had a bunch of questions coming in through the chat, and then through the Q&A as well. So I want to try to get to as many as possible. Hold on, let me
Sure.
just read one. In dealing with social anxiety when you have been bullied how do you deal with social anxiety when you've been bullied for your whole life? Scars on your face.
Yeah. So I think the thing that we didn't get a chance to really get into is like the complexities associated with social anxiety and the complexities associated with substance use, right? Each one of those could have been their own presentation by themselves. Um, with social anxiety, I think on the surface, again, it looks very plain, like just go out and engage with people, like face your fears, do all of that stuff, go give that presentation. But it carries with it so much because it is associated with others around us, and we're constantly surrounded by others. And especially when we're holding on to those thoughts or those feelings or those memories of things that have happened that actually are factual pieces that our anxiety hang on to, it can be very difficult, I think, for us to move past or to get past. I think that whether the scars that you're talking about are physical or emotional scars, ultimately, what you want to be able to do is to change the way, or what you where we want to have you go is to change the way that you're thinking about it, change your relationship with that experience. And that's not to say that experience wasn't painful. It's not to say that your anxiety isn't valid. That's not to say that it's not associated with real life things. But and those experiences don't have to be the thing that decide what happens for you moving forward. I think that if we are thinking about social anxiety in general, we want to be able to help people get to a place where they can challenge those experiences, or the perception of those experiences as much as possible. That's not to say that bad things won't happen. So I've had experiences before with people with social anxiety where the exposure didn't turn out exactly how we had wanted it to, but ultimately we were able to change a perception because we were learning over time that whether good or bad or in between, we're able to deal with the thing. We're able to tolerate that experience. And so for someone who's been carrying these socially anxious thoughts around for 20 years, my expectation is that they're going to be really ingrained, right? And there's probably a ton of information there that you picked up on over time that really supports that. And we don't want things to be really black and white. It can look as if it's that way all the time, but oftentimes it's not. There's another side to it, right? And it's about helping us shift our attention to what may be over on that other side, or what's in the in between, that gray area. How can we help you to learn to challenge some of those things in such a way that they don't hinder you from interacting or building relationships with anyone else moving forward? Because that's ultimately, I think, what you'd want, right? So it's a very complex thing, a very difficult thing, but I think it's about being able to shift our perspective and help us to challenge some of the really ingrained thoughts that have been there.
Yeah, I think it's also really important to just acknowledge that, for whomever wrote the question, that, being bullied for your whole life is a traumatic experience.
Absolutely.
And, there's a process of healing that, again, it's like there's anxiety, there's trauma, there's substance use, and they all go together. And I just wanted to validate that and recognize that as well. We have so many questions. We're going to have to send answers to a lot of the questions.
Sure.
But I'm going to keep going through. How do you approach a 20-year-old male who uses marijuana to soothe his anxiety, to recognize how harmful heavy weed use is for his anxiety and overall health?
Yeah, so that's really hard. Let me start out by saying that that's really hard, because marijuana is one of those things that people use for dealing with social anxiety, and it's really effective and it's super accessible right now, right? So it's very, very hard to be able to do that. I would say that whether I'm having someone come into my office or think about coming into my office, sort of wherever they are in that stage of change, I'm looking for the things that help to hook them, or that might motivate them to want to change their behavior, right? If someone is using heavily and has been using heavily, they're using heavily for a reason. There's something that's there, right? And not all social anxiety comes in the same colors or flavors. There's all this different reasoning, there's all this different stuff that contributes to why that person is experiencing that social anxiety. I might start with just trying to understand what it is that that person is trying to escape from. What is that experience that they're trying to get away from? What is it that the marijuana use is kind of helping, right? What are they noticing? And from that, can we begin to introduce to them the fact that this is not the only way to deal with it? It's good, it works in the short term, but if we're thinking long term, it's probably not going to be the most effective thing for us, right? So are there other ways that we could possibly look at that? And not necessarily assume that just because they begin to look at it in a different light or in a different way, that it means that the marijuana use is going to completely stop. But if I can get an inch in there, if I can get just a little bit of a peep in there, some sunlight in there, I can begin to help change your perspective on where things are. So I would start first with trying to understand what's going on for the individual. And then from that place, try to help them explore what else may be out there that they could perhaps try to do that would be different from what may be going on, what they may be doing at this moment.
Mm-hmm. Yeah, it's so hard with this, especially, well, with any age group, but especially with the adolescents and the young adults. I think that again, it works. So it's
Mhm.
not like they've chosen this like bad solution to their issue.
Mhm.
Smoking, drinking temporarily makes you feel it anesthetizes you. You don't have
Mhm.
anxiety. So they've chosen a solution that works for that symptom temporarily. It just also unfortunately has a bunch of other added negative consequences that go along with it. I think that there's such a power in the relationship that a client has with the clinician that can be, if that relationship is really strong, and really rooted in respect and trust, that can be leveraged. We know that just say no doesn't like work.
Mhm.
But if they have a relationship with a provider who they truly trust, then the psychoeducation element seeps in a little bit more. So saying to them, you're right, like smoking marijuana is going to make you feel better until it doesn't. And here's the reason, like, here's the brain, and here's the reason why. They won't hear it from you on the first session. Once you actually have rapport, they'll begin to believe and trust a little bit more. And just pointing out, I think that once that psychoeducation comes in and they begin to understand, like, oh, wait, so yes, I did feel much better while I was high, but the next day when I didn't have any more alcohol or didn't have any more marijuana, I actually felt like 10 times more anxious.
Mhm.
Um,
Mhm.
and just helping them to understand that too.
Absolutely.
Just checking time. Let's do one more.
Okay.
Uh, this is more of a comment. I once heard that addiction or misuse was the only way a person knew how to survive at that moment. It really resonated and made me start to consider not only what others are going through, but what I did to myself as well. It opens the door for empathy.
Yeah,
Absolutely.
absolutely.
I love that comment. Uh, this is a good one, and we can end with this one. How do you work with anxiety that an adolescent isn't able to verbalize that stems from early developmental trauma?
That's a great question. That's a fantastic question. So if I'm being 100% honest, a lot of times when people are coming into my office, they can't necessarily verbalize what's making them feel anxious or what their experiences are. They know that they feel bad, whatever bad means. So when I spoke earlier about those foundational pieces, about raising mindful awareness, about developing coping skills and cognitive coping skills, a part of that is for them to be able to start to verbalize what their experiences are. Now, I'm not going to expect that someone is going to be able to tell me the origins of where this came from or the things that are reinforcing it. But what I am looking for are situations that they can describe that feel uncomfortable for them and what that feels like inside their body and what it makes them feel like they want to do and the thoughts that they start to have. And I use that as sort of the base to be able to work with someone. Now, if we're talking about something that has happened in early life, I'd be curious about how it is sort of playing out in this current phase of life, right? My focus may initially be on let's focus on you being able to deal with this specific situation, right? So being able to, let's say it was traumatic separation, and so there are attachment issues and worries about attaching to others, right? I want to be able to help them deal with that in the moment because that's the thing that's got them coming into my office. I think after that, we might have some space with that built up mindful awareness, with more of a willingness to explore now because the stimuli doesn't feel untouchable. We might be able to explore, how do you want to deal with this, or what may be going on, or do we need to shift treatment in order to help you deal with this traumatic piece as it's happened in the past. So I think I'm thinking about the behavior first, in that moment. How do I help to create, how do I help to raise your awareness so you're able to tell me more about what your experience is? How do I help you deal with that? And then how do we then take a step back and look at the more maybe traumatic things that have been occurring?
Thank you. So before we conclude, I just want to acknowledge that before some of the questions started coming in the chat, there were some comments around biofeedback and neurofeedback. And I know we don't do it at the dorm. I don't believe you all do it at CMC either.
No, we don't.
I will say that we have many clients who we work with, outside providers who are doing neurofeedback and biofeedback with clients, and having that holistic, multi-pronged, different types of interventions going on simultaneously approach is can be wildly successful. And we've had a lot of clients that have reported significant progress in terms of the symptoms that they are experiencing after participating in neurofeedback and biofeedback as well. So I just wanted to say that before we concluded. So thank you, Kimberly, for that comment. Thank you all so much. As I said, I'm sorry we did not. We normally, this is like a great question group, a lot of great questions. We will go through them. We will send out emails to everybody so that we can address all of them. Thank you so much for attending. You will get slides. You can see everything on YouTube. And again, thank you, Dr. Myers, especially for that awesome presentation.
Thank you so much for having me, and thank you all for being here.
Okay.
Take care, everyone.